I'm going to be talking about some work I've done in primary care regarding chronic pain and addictions. I looked at all patients who were prescribed an opioid substitute treatment, OST, in the last 3 months, either by a GP or by the CAT team. And OST was defined as being either methadone or Suboxone. I looked at patients in 5 GP practices who had a total population of almost 17,000. All practices were are in a deprived area of Greater Glasgow and Clyde. I looked at whether the patients on the OST were also prescribed a hypnotic, anxiolytic, opioid or pregabalin or gabapentin. So there were 441 patients on OST, and about a third of them were under the CAT team. 2/3 of the patients were male. I collected data on 409 patients, as the 32 patients who were under the CAT team had either left the GP practice or were unknown to specific practice. The median age of patient was 42 years. 2.5% of the practice population were prescribed OST, and the vast majority of patients were prescribed methadone. The median daily dose of methadone prescribed was 65 milligrams. 57% of the patients were prescribed OST only. About a third of the patients were prescribed OST and either a hypnotic or anxiolytic, an opioid or pregabalin or gabapentin. And 8% of patients were prescribed drugs from 2 of these groups. 1% of patients were on a drug from all 3 groups. The 3 group patients were on higher doses of methadone or Suboxone than average. For those patients prescribed 1 or 2 of the auxiliary drugs, the methadone Suboxone dose was highly variable. Only 3 patients were prescribed a step 3 analgesic, and they were all prescribed MST. 1 patient was on 20 milligrams per day of MST, but was also on 240 milligrams of dihydrocodone. Another patient, who actually was palliative, was prescribed 180 milligrams per day of MST and Oromorph. And the 3rd patient was on 300 milligrams per day of MST, and he was also on a large quantity of benzodiazepines. And there was a letter from the pain team suggesting he may be a good candidate for a joint pain CAT team consultation. 11% of the OST patients were prescribed a step 2 analgesic. 17 patients were prescribed more than 200 milligrams per day of either tramadol, dihydrocodone or codeine, and 3 patients were on 400 milligrams per day or greater. 35% of patients were prescribed either a hypnotic or an anxiolytic, and the vast majority of those were prescribed diazepam. Only 9 patients were prescribed a Z drug. 6% of patients were prescribed 2 hypnotic or anxiolytics, and all of the patients on the 2 hypnotic or anxiolytics were on diazepam and 1 other drug. 6% of patients were on an opioid and a hypnotic, and the median diazepam equivalent daily dose was 20 milligrams, although as you can see the range was rather large. 6% of patients were prescribed either gabapentin or pregabalin, but the vast majority were prescribed gabapentin. The median daily dose of gabapentin was just over 1,000 milligrams. 3% of patients were on pregabalin or gabapentin and a hypnotic or anxiolytic, and 2% of patients were on an opioid and pregabalin or gabapentin. So there are limitations to the work that I have done. Namely, I only looked at patients on OST, and I did not look at patients with addictions not on OST. And I haven't determined the reasons for auxiliary prescriptions with opioids or hypnotics, anxiolytics, etc. And I didn't ascertain which service initiated these treatments. And neither have I determined which patients are currently under the pain team.